So that was probably the least fun I've had in a while. All right, don't let this fool you, it's not that bad. I got the implant, and at this point, the post is in and there's like a little metal screw cap on top, but there's no crown and there won't be a crown for a few more months. So I had 3 questions when I walked into the office, and I said, can I ask you my questions now because I'm gonna get really distracted and I'll probably start crying soon. So here are my 3 questions. 1, can I wear my retainer during this procedure for the implant on the bottom? Can I wear my top retainer? The answer was yes. Can I have dairy after this appointment? Because when I had my wisdom teeth out, they said no dairy for the first, 2 days or something. And all the food, the soft, cold food that I had prepped back at my house, like waiting for me after the surgery, was all dairy. Cottage cheese, ice cream, pudding, you know what I mean? Like all dairy. So the answer was yes, you can have dairy. It's not limiting like that. They're not extracting teeth, so there's no dry socket. There's nothing that they're worried about, bacteria or whatever. So that was great. And then my other question had to do with my lower retainer. I knew that they created it with enough space so that once the implant, like not the crown, but this implant was placed, there would be enough room for it. So I put the retainer on this. You see the plastic kind of dips right there. So I just wanted to make sure that, whatever they did with the implant, that I could still wear this because I need to be able to wear this. It's totally fine. It has enough clearance, as they say, even with the implant and bone graft on the side. This doesn't interfere and I can wear it at night. It's fine. A lot of people will tell you that an implant is less painful than wisdom teeth extraction or a lot of other dental procedures, and after going through it myself, I'm inclined to agree. It's not without pain, but it's definitely on the lower end of the spectrum. A typical implant appointment, they say, takes about an hour. Mine took about 2. I needed a bone graft. They were working with a very narrow part of my jaw that needed to build up more bone. But the good news is they were able to accomplish the bone graft and the implant at the same time. I didn't have to fast before my appointment because I didn't get anesthesia. So I had like a big shake for breakfast. Again, would highly recommend that you do that if you are in the market for some oral surgery and you don't have to fast, don't fast. So let's talk experience. I was very nervous. When they called me in, I was fighting back tears. I've had problems with my teeth and my jaw, and I've just had a lot of stuff going on for a long time. So I have like nightmares about my teeth. And so it makes me extremely nervous to have any dental work done. And I've had a lot of it. So I was fighting back tears when they called me into the room, and they kept reassuring me it's not as bad as you think it's gonna be. It's actually pretty easy, pretty painless. It's an hour in and out. And the worst pain was actually the expander that like pulls your cheek to the side. And they had gloves on, but for the most part, he had to use his finger because of where my implant's located. So they were doing this for 2 hours and making me look that way. So it was like, really? So that was actually, I'm not even kidding, out of the whole thing in terms of like pain, that was the most painful part. Shots hurt, and I had to get 2 shots that you could feel, meaning I got more of the shots once I was numb. But the first shot, they put it all the way in the back in that soft tissue spot. It pinched, but they're very good at it and they go very slow. So you like feel a little pinch and they go a little bit deeper, and you feel a little bit worse of a pinch, and you feel a little pinch again, and then they extract the needle. So yes, I had 3 painful pinches, but I can get over a painful pinch. But 2 hours of punt or take like that, I had bruising, a little bit of bruising right here. Didn't have a split lip, didn't have dry cracked lips or anything, but it was just like radiating pain for like 2 hours because this isn't numb. This isn't numb. This was all numb. I couldn't feel my chin, couldn't feel even up to like right under my eye. It was all numb, which was good, which you need. I also got a headache on this side, and that was because they put a bite block between your teeth. So to keep your mouth open, they didn't use those things that hook in here. They didn't use those. They used a bite block, which you can kind of like picture something, I don't know, like this, but softer. And what they do is they make you open your mouth and they put it in between your teeth. Aha. So to keep your mouth propped open the whole time, they put, it wasn't this tall. They put the bite block in and they make you rest your teeth on it here while they're working over here. For 2 hours, stretching open pretty wide, I got like a bit of a headache right here. It wasn't unbearable, but I'm just trying to explain like what was painful, what was unexpected. So for me, the worst part was knowing what they were doing and the sounds. The drill isn't the type of drill that you expect when they do like cavities or like really loud whirring drills. It's not like that. The drill was more vibration than anything. So they kept drilling to get, you know, into the bone to put the implant. And it's just a weird sensation when your whole head is just kind of vibrating, but it's like a low sound. There's not like that high-pitched whirring, a sound that you associate with a dentist's office. But in order to get your gum prepped and whatever, they have to make some incisions. So they make 2 incisions, like if here, this is your jaw, like right inside. They make 2 incisions down and 1 incision across the top. And they kind of pull the flap back. I know, it's gross. They pull the flap back of your skin so they can get to your bone. And I had to have a bone graft, right? So they had to build up this bone. So they really, what was the grossest thing to me, and I can still like feel the sensation. And again, you don't really feel it, because you're all numb and stuff, and they're touching bone. You don't have nerve endings in your bone. But they're scraping off the skin, the muscle tissue, the blood, and everything to just expose your skull. It's weird. So that scraping with the side of a scalpel or whatever, to like, that was just a weird sensation. I knew what they were doing, so that made it even weirder. But they really jumped right in. Like, I was numb. They left me to get numb for like 10, maybe 15 minutes. They came back and the doctor like looked in my mouth and like started poking and prodding and stuff. And I only realized like after I heard it that he was making those 3 incisions already. Like, he wasn't checking anything. He wasn't asking me, you ready to go? He just kind of like, zoop, 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 like sawing. And it was just like, bleh. So for me, it was the knowing what he was doing was kind of just grossing me out. But they were very patient with me and kept checking in and saying, if you need a little break, just let us know. We'll give you a little break. But I needed it over with as quickly as possible. Like, I didn't want a break. I just wanted it over with. And it's like meticulous. They have to take their time. So they stop, they take an x-ray, they gauge if they're putting it in the right position. They have a guide. So they use like a mold of your teeth. Here's where my implant was placed. So my implant was placed right here, and throughout the surgery, they had to keep stopping and like putting a little film in the hole or behind it, or like had me bite down on something, and they'd leave and take an x-ray, and then they'd look at it and say, okay, it's going in the right spot, let's keep going. And that was interesting because my teeth, like, you know, you're holding your mouth open for so long and there's so much pressure and stress on your mouth that when they have you close and they're like, okay, bite down on this and hold it there for the x-ray, my jaw was like my teeth were shaking, so I couldn't really get a good grip on what they were doing. And I was just like, I'm sorry, you know, and they're like, it's fine. So like, you know, I'd close my mouth and it would be like, and there was one point when the x-ray wasn't giving them the information they needed. So they were like, okay, we're gonna walk you outside and we're gonna have you sit in that x-ray that goes like all the way around your head. So I was like, I had to get up, like, you know, I knew my gum was like cut off and hanging open, and I was like, oh, you wanna go outside? It's okay. I'm like, yep, no worries. You know, I wasn't under any anesthesia, so I was completely lucid. They took the gown and that heavy x-ray bib off and kind of just walked me out to the hall, and I just sat down. I had all this gauze in my mouth, and I did the thing where you hold on and you like bite down and the thing goes around your head. And I was biting down, I was like chattering, like, so that was kind of funny. And then it was just more of the same. They kept doing a little bit of drilling, they kept checking things, and then he was updating me all along saying, it's looking good, we're really pleased with this. We're able to achieve primary stability, and primary stability, I guess, is the most important thing. They want to make sure that the implant's going to take, that your jaw will hold it. So at one point he did say, yes, there's less bone here than there should be. We expected this, but we can achieve primary stability today, and we will do the bone graft, but we'll do the implant at the same time. And I was like, oh, thank God. So they did a bone graft, and the bone graft, you know, you're already exposed, your gum flap is open. So they put the donor powder in, and then they take a small square of paper. So it was probably this big. He had it with tweezers, you know, so I have some tweezers right here. So he was like going to put this in my mouth, and I was like, what is that? And he said, this is the membrane or whatever. And I was like, okay. He's like, we actually put this over the bone graft, and then we stitch you up. Like, this stays inside your face. He was like, you wouldn't believe how much this piece of paper costs. So whatever, he puts it in, and then he sewed me up. And you don't feel the sewing at all. You know, you see that little hook needle, and they're, you know, doing this, and you're just like, bleh. I take that back. I felt a little bit of a sharp pinch at one point while they were sewing, and he stopped and he said, you okay there? Your brow furrowed. And they were so good. Like, they kept noticing when I would like wince. So they would notice that, and they would keep checking in with me. They'd be like, hey, did you feel that? It looks like maybe you felt that. And I would just be like, or like, and they'd be like, okay. It really only happened when I got up to the sewing, the stitches. They went ahead and gave me more local. They were like, that shouldn't be wearing off yet. But it did take 2 hours, so it was longer than they expected. They gave me like 4 more shots at that point, because they had to finish all that. I left there at like 1:30, and like the numbness didn't completely wear off until about 4 o'clock in the afternoon. So I was really numb, especially with those extra shots that they gave me. So they sewed it up, and you know, like I said, if this is your jaw and they make 2 incisions down and 1 across, and they fold it back up, they make a stitch on this one side, a stitch on the other side, and then a stitch on the top on either side of the implant site. Now the implant is like a post that goes into your jaw. But what about the top? It's not like a pointy needle. They don't leave that there. So they screw a little metal, like almost like the head of a nail or a washer. Like they screw this little top on, and they use the tool where they like put it on the top, and then they crank it, and you hear the clicking. It's so strange. So like I heard the clicking as they were like tightening it, working it back and forth, and it was like, it was really weird. I was laughing. Then they told me how to use all the rinses and stuff, and like what not to do, and hot foods to avoid. No popcorn for a while. No potato chips or tortilla chips, anything that could potentially like hurt the site. It's gonna be a few months of only eating on that side. And I have a post-op follow-up in 2 weeks. And they were like, okay, you're good to go. And I was like, can I see it? Because I feel like I'm gonna leave here and I'm gonna go look in the mirror and I'm gonna freak out because I don't know what it's supposed to look like. So I won't know if something's wrong. And they're like, oh yeah, sure. So they laid me back, gave me a big mirror, and pointed and explained. And I'm really glad that they did, because when I opened my mouth and I looked, I was like, ugh, oh my God, what is that? That looks bad. Why does it look like that? So I am very happy that I had asked. So this is what it looks like today. Again, this is 4 days post-op. You can see the cap on the implant. You can see the stitches. It's not very pretty, but it's definitely getting better. It's not infected, and I am just babying it, being super careful, because the last thing I want is a complication. I'm about 4 days post-op right now, so the pain is minimal at this point. It's been pretty minimal all along. They gave me 3 things to take home with me. Amoxicillin, you take 2 pills an hour before your appointment, and then 1 pill 3 times a day until they're gone. So that's to help prevent infection. I was also given hydrocodone acetaminophen, and this was kind of as needed pain medication. I was advised to wait until the numbness wore off from the implant procedure to decide whether or not I needed something stronger than like ibuprofen. So as soon as the numbness wore off, I kind of made a judgment call that like I did need one of these. I probably could have skipped it, but I was home alone and there was no reason not to be comfortable. So I took one, and then about 5 hours later, I decided to take one more because I started talking on the phone to someone. The stitches are along the side of my gum, so talking obviously irritated it. So I popped a second pill. So I just took 2 on the first day, and I did not take any more after that. I do not have a high tolerance for pain, so that was my experience. Take it for what it's worth. The ibuprofen I'm still taking pretty regularly. So I've been taking 2 pills every 4 to 6 hours, but being careful not to go over, what do they say? Don't take a certain amount of these in a 24-hour period. Yeah, do not exceed 6 tablets in 24 hours. So I'm pretty much taking 6 tablets a day in total. I was also given chlorhexidine, 0.12% rinse. So you take about half an ounce in this capful and use it like a mouthwash once in the morning after breakfast, which I find to be odd, and then before bed. And you use this for 2 whole weeks, which is why there's so much. To minimize the medicinal taste, do not rinse with water immediately after use. So I've been following that. It doesn't taste bad. It's fine. It's not a big deal. And then they gave me things like a bunch of gauze just in case the bleeding started again. They also gave me a super soft toothbrush to clean the 2 teeth on either side of the implant site, just so that you're not, getting your regular hard or medium toothbrush too close to that. I personally use Sensodyne because I have sensitive teeth, and I have to clean my retainers from the braces every morning and night also. So I have a really long get ready for bed and like wake up routine because I have Colgate Enamel Health, just like a trial size toothpaste to clean the retainers with my normal toothbrush. And then I use Sensodyne with my normal toothbrush on my teeth, but then I use Sensodyne on the super soft toothbrush for the 2 teeth around the implant site. So it's kind of annoying to do all of that before bed and right when I wake up, but it's in my best interest, so I do it. And as you saw before, they also gave me a head wrap and an ice jelly pack. So the advice was to use this for the first 24 to 48 hours. So you actually can just slip this in here, and it's very convenient. You just tuck it under your chin. So the whole jelly pack, this is where the implant site was. So in my jaw, so you just kind of line it up under your chin, not on your face actually, but under your chin. And go like this. It's very silky, it's very comfortable. It's good if you're working on the computer. They also gave me some black tea. I don't know why, because they specifically say for the first 48 hours to only eat cold, soft things. Yogurt, applesauce, cottage cheese, Jell-O, pudding, that kind of ice cream. And only eat it on the opposite side of your mouth. No hot food, because the hot food could cause the bleeding to start again. So I'm not really sure why they gave me tea. I mean, I love tea if you've seen some of the other little videos on my channel about getting ready with tea. So I always appreciate a good cup of tea. It also has iced tea instructions. Maybe they're suggesting you make some iced tea, a little bit comfort food. And I've got my bill here, and I just want to be transparent with people because when I did my research, there wasn't really anyone out there sharing what the costs were for them. I had an endosteel implant without anesthesia. I had a local So like I had a couple of shots. I was not able to have any insurance applied. So this is a pretty good estimate on what things might cost you because I had to pay all of it. The bone graft at the time of the implant was $500. Then I have another item on my bill called guided tissue regeneration. That was $600. And then the endosteel implant itself was $2,315. That's a lot of money. And it wouldn't hurt as much as it does, if I hadn't just gotten orthodontia. So there's that massive cost and this massive cost. And it's just, then I have to get the custom abutment placed and then the crown. And I'm just like, take all my money, take all my money. So I hope that this was helpful and reassuring that it's really not as painful as you might worry that it will be. The weirdest and most uncomfortable thing for me were the sounds it was making and the fact that I knew what those sounds meant. And that unexpected pain, as well as a headache, the duration of 2 hours, the cost of $3,400. All of my prescriptions were covered at least, so I probably spent under $15 to get the amoxicillin, the hydrocodone, and the chlorhexidine rinse. So I'll post another video on the custom abutment that I have to have done, as well as the crown when that gets there. Hopefully there will be no complications. The last thing I want to do is have a complications video. But I hope that this helps some people. And if you have any questions whatsoever, please feel free to put them in the comments below. I am recovering and wearing my super comfy Logan Paul merchandise. All right, have a good one. Thanks for watching. Bye.